you for helping me out with that audio visual check. I am glad to see everybody can hear me clearly and see my screen, which is the first slide of a PowerPoint presentation. So my name is Carla. I am the Director of Education at NeedyMeds, and today I'm going to teach you how you can help your patients or clients save on their healthcare expenses through NeedyMeds. Before we get started, I want to go over just a few things. You can feel free to ask any questions that you may have by typing them into the questions section of your GoToWebinar control panel. Just know that I will reserve answering questions until the end. If I don't get the chance to answer your specific question, I will follow up with you personally via email either later this afternoon or first thing in the morning. Of course, I'll provide my contact information as well as the contact information for NeedyMeds in general. And you should be able to download a copy of my PowerPoint presentation in the handout section of that GoToWebinar control panel. Of course, if you have trouble accessing it or need me to email it to you, again, you can send me a message in that questions section of the GoToWebinar control panel. So with that, let's get started. For those of you that are not familiar with NeedyMeds, I always put a snapshot of our website homepage up there because really our website is the face of our organization. NeedyMeds is a national nonprofit founded in 1997 by a retired physician, Dr. Richard Sagal, who is our current president. What you're looking at on the screen now is our updated mission statement. Essentially, what we do here at NeedyMeds is we connect people to programs free and anonymously through our website and helpline to programs that will help them afford their healthcare expenses. What you're looking at now on your screen is a list of our most effective and popular cost savings resources. And I'm going to walk you through most of those on the website so you can see, hopefully, how easy it is to find what you need on the NeedyMeds website. So with that, let's get started. So bear with me while I escape out of the PowerPoint presentation and onto the NeedyMeds website where I can walk you through how to navigate it. And I hope you'll agree that it is a pretty easy website to find your way around once you get the hang of it. I do again encourage you to ask any questions by typing them into the questions section of your GoToWebinar control panel. So let's say you're helping a patient or client try and find a cost savings program for a medication. You can start very simply by typing in the name of the drug, whether it's name brand, or generic, into that drug search field where my cursor is blinking on the top left-hand side. Or you can start by looking for what is called a prescription assistance program. And you'll find that under the Patient Savings tab, which is where we're going to spend most of today's webinar. Let me make that a bit smaller. So you'll notice when my mouse hovers over that Patient Savings tab, a whole bunch of different categories pop up. And those are all the different ways in which you can help your patients or clients save on their healthcare expenses. Again, you can search for all of this for free and anonymously through our website. But I also encourage you, if you don't have the time to walk a patient or a client through our website, you can refer them to our toll-free helpline. We are located in Massachusetts on the East Coast, so we're open 9 to 5 Eastern Time, and we do have Spanish-speaking counselors. So let's return to that Patient Savings tab. And let's say you're trying to find a cost savings program for a brand name drug. You'll begin that search on the top left-hand side. And you'll notice there's a bunch of different links and ways you can find help searching for a program, for a cost savings program for a medication. You can find it according to probably the least popular company or program name, or you can search according to the generic or brand name. Let's go ahead and try and find a cost savings program for a brand name drug. When I click on that brand name option, you'll notice a bunch of icons pop up. What these icons do is they let you know what type of cost savings program or information is available for that drug. For example, it will let you know if there's a prescription assistance program, whether or not there's a coupon, if there are support pages available, which are links that provide additional information about that medication. Or maybe there's a drug video, which is exactly what it sounds like, a very brief video that will provide pertinent information about that medication. So again, we're starting this webinar by doing a search for a brand name drug. And when you're looking for help with the brand name drug, you're always going to want to search the Prescription Assistance Programs database first, because they offer by far the most cost savings available for a prescription name brand drug. For those of you that are not familiar with what prescription assistance programs are, I wasn't before I worked at NeedyMeds. What they are is they are programs that are supported by pharmaceutical companies that offer usually free, but sometimes deeply discounted name brand medications to those who qualify. If you're ever watching TV, for example, and you see a commercial for a name brand drug, and at the very end of the commercial, either in small print at the bottom of the screen, or the narrator will say very quickly, if you're having trouble affording your medication, AstraZeneca may be able to help. That's an example of a prescription assistance program. Prescription assistance programs, again, they offer the most cost savings program for brand name drugs. And since there are no rules or laws governing these prescription assistance programs, how the pharmaceutical companies run them will vary from program to program. What will also vary from program to program is the eligibility criteria, but it's almost always based on insurance status as well as income. We'll get into that in just a moment. And the other thing that is pretty consistent with prescription assistance programs is that the doctor will need to be involved by both providing the prescription and signing the application. So let's say we're looking for assistance for a brand name drug called Lipitor. You'll notice, and I'll make the screen a bit bigger right now, that there's an A to Z index. We have that throughout our websites for our large databases to make your search easier. Obviously, I'll choose the letter L for Lipitor, and then I'll scroll down the list of medications until you find it in the list. If the medication is listed more than once, which it is here, that's because it's available in a different formulation. I'm going to go ahead and choose the top hyperlink, and there those icons are again. The one on the right indicates that there are support pages providing additional information about Lipitor, and the one on the left indicates that there is an assistance program available. I'm going to go ahead and click on that hyperlink. You'll also notice at the top in this blue bar, it says program 1 of 3. That means exactly what it sounds like, that there are currently 3 prescription assistance programs for Lipitor. When there's more than one, we list the program that offers the most assistance at the top and the ones that offer the lesser assistance towards the bottom. So let's take a look at what these prescription assistance programs are all about. At the top, you'll always find the name of the supporting organization, which is in this case RH Outreach, and right beneath it, their contact information. That's really important because the contact information is where you're going to want to direct any questions you may have about the program. So you'll call RX Outreach as opposed to calling NeedyMeds. Underneath that, you'll always find the application and form. As you scroll down, you'll find the all-important eligibility requirements section. And as I said, although eligibility will vary from program to program, it's almost always going to be based on insurance status as well as the person's income. And the income is always based on a certain multiple of the federal poverty level. And if you're like me, if somebody asked me to tell you where my income falls in the federal poverty guidelines, I would have no idea. So to make that easy for you to see whether or not your client or patient is eligible, you can click on the convenient federal poverty level calculator. Let me show you how easy that is. Let's say you have a patient that makes $47,500 a year, and she's supporting a family of 3. That's all the information you would need. You simply hit calculate, And the yearly income here indicates that it is 228% of the federal poverty level. A couple of things I want to point out. You'll notice when I typed in the income, I only put in the digits. Don't put in periods, commas, or dollar signs. And that's the same number that a person would put on their tax return form at the end of the year. Returning to the eligibility requirements section, you can see that this person is eligible, which is great. But what happens, for example, if the person wasn't eligible? Maybe they found themselves just above the eligibility requirement at 305 or maybe 310%. Then we would suggest that you call the program and ask them to make what is called an economic hardship exception. They do that all the time, and it's certainly worth your time. Other important eligibility requirements is whether or not, for example, somebody needs to reside within the United States. And we get a lot of questions about citizenship status. If the person actually needed to prove legal residency, it would say citizenship. But when it says reside in the United States, it means that. It means that the person simply has to be living here. As you'll scroll down, you'll also find the application section, which lets you know the details of applying. The medication section lets you know how you will receive that medication and the details for reapplying. And always be sure to check out the additional information section. That's really important because that's where we're going to put pertinent information that doesn't fit neatly into the other categories. Before we move on from prescription assistance programs, again, I want to encourage you to submit any questions you may have into that question section of your GoToWebinar control panel. Just know I'm going to wait to answer questions until the end. But anyway, returning to the patient savings tab, you'll notice there's a section called Help with Prescription Assistance Applications. Sometimes prescription assistance applications can seem complicated, especially when somebody's not used to doing them. If you don't have the resources at your place of business to help somebody complete a prescription assistance program, you can check out this website. You simply type in the zip code of where the person lives and see if there is a location that will help your patient or client apply for a prescription assistance program. The programs we have listed in this database are nonprofits or organizations that will help the person for free or a very nominal fee. Please understand that this database is by no means exhaustive, so if you are aware of a program in your area that isn't included in our database, please let me know. And conversely, if you're looking for a program in your area but one doesn't exist, let me know that too, and we will have our researchers see if they can find one. So let's move on along through the Patient Savings tab. And one of the other programs databases that I want to point out is called the $4 Generic Discount Drug Program. This is a directory of all the discount programs for generic medications available at major retailers. Now, although it's called the $4 Generic Discount Drug Program, most will range in price from $4 to $15 for a 30 or up to 90-day supply. Like the other databases, you'll start to see that there's a number of ways you can search. You can search by state, you can search for the name of the drug, you can even search for a pharmacy. To keep things simple, I'm going to do a quick state search for Florida, just so you can see what the results will yield. And hopefully you'll agree when you look at this snapshot of the 10 $4 discount drug programs available in Florida, that all of the information you'd like to pass on to your client is now on your screen. It includes the store name that's participating and a hyperlink. The middle column, program name, lets you know exactly that. What's the name of the program that this store is providing? And the right-hand column is the most important. It lets you know what exactly this program is going to help your client save on. And you'll see that, as I had mentioned, although we call this database the $4 Generic Discount Drug Program, Most will range in price from between $4 and up to $15, although it can be a little bit costlier in some situations. Also, sometimes, as I'm highlighting right here, they will actually provide the savings in a percentage as opposed to a dollar amount. Returning to the Patient Savings tab, another really important destination on our website is the free, low-cost, or sliding scales clinic database. You'll notice that there are actually 4 databases under that category. We have medical clinics, we have dental clinics, but since the beginning of the year, we've actually created 2 separate databases specifically for mental health and substance abuse clinics. For the purposes of this webinar, I'm simply going to click on the medical clinics hyperlink. Just know that all of these other websites are all of these other databases are set up the same way. Now, as you can see, this is a pretty robust database. We have more than 16,000 clinics across the country. So I'm going to go ahead and do a zip code search because this is such a large database. So let's do a zip code search for zip code 23223. We'll do a 5-mile radius. And as you can see, there are 22 clinics within 5 miles of the 23223 zip code. And again, I hope you'll agree that all of the pertinent information is now on your screen. The print column on the left-hand side we'll get to in just a moment. The next column, labeled clinic, lets you know the name and the contact information for that clinic. The next column, eligibility, lets you know who can be seen at the clinic. And something I think is really important, whether or not the person can expect to pay a fee, and if so, what is that fee based on? And the details column on the right-hand side will let you know what services this clinic provides, the hours of operation, and what areas they search. As you can see, a lot of the clinics, medical clinics, for example, offer additional services such as social services or dental services. So check out the details to see what services that specific clinic provides. As you would imagine, we pride ourselves on the information on the NeedyMeds website being accurate and up to date, but I really want to stress that we suggest you give the clinic a call or have your patient or client give the clinic a call or check out their website to confirm things such as hours of operation, the languages spoken, and to confirm the fee. Now, let's say you just found these 22 clinics that you think your patient or client would be interested in. You can choose the print all option, and you can do exactly that. You can print every clinic listed that resulted in this search, or you can, underneath the print column on the left-hand side, click only the clinics you think your client would be interested in, and then choose the print instead of the print all. And this will do exactly what it sounds like. It will generate and print a list including only those you choose. And that really is a great tool for healthcare professionals that may want to provide their clients with a list of clinics for them to choose from, but not overwhelm them. Another important section on our NeedyMeds Patient Savings tab is the coupons and rebates section. This is where you can find prescriptions and over-the-counter medications or supplies for which there is a discount, a free sample, or a rebate. And like our other databases, you can search a number of ways. You can search by the brand name drugs, you can search for the product name, but in this case, you can also search by category, which refers to medical diagnosis or medical category. So let's say you have a patient or client struggling with blood pressure. Go ahead and click on that hyperlink, and you will get a list of all the medications, and any other health-related need for that diagnosis. We actually updated this database the beginning of the year to be a little bit more user-friendly. What I mean by that is we used to simply have a paragraph of text describing what this coupon or rebate offered. Instead, now we do a bullet point list because it's easy to read. We also will provide a direct link to the manufacturer's website and a convenient place where you can have the NeedyMeds drug discount card texted, emailed, or printed out for your client. And we'll get to later on why it's going to be important for you to familiarize yourself with the NeedyMeds drug discount card. The great thing about the coupons and rebates database is that it will also let you know if another cost savings program is available, or whether or not there is more information available about that medication. For example, just like the prescription assistance program, you can see whether or not there's a support page, whether or not there's drug videos, whether or not this medication falls into the $4 generic discount drug program, or if there is actually a prescription assistance program available. If you happen to stumble upon the coupon section of our website and you find while you're looking for a coupon that there's actually a prescription assistance program available, always try and have your client apply for that prescription assistance program, because again, that's always going to offer the most. So since the coupons and rebates section, you can search for help according to medical category, I want to point out another section on our database where you can do that as well, which is under the diagnosis-based assistance programs. And this is probably the second most popular destination on our website, and it's also the second greatest source of savings. Diagnosis-based assistance programs provide financial assistance for costs associated with a particular disease. Now, this database is different because for the most part, it doesn't include medications. Mostly what it includes instead are other necessary medical expenses. For example, maybe you have a client that needs help with medical supplies, medical equipment, testing strips, or maybe they're looking for help affording something like a wig or house cleaning services or assistive technology. Again, like the other databases, you can search a number of ways. You can search by the probably least common program need. You can search according to your state, and you can also search by diagnosis. When I'm talking about diagnosis-based assistance programs, I'd like to use the example of diabetes, and I'm going to choose the letter D in the A to Z index. And you'll see, since diabetes is such a broad category, it's broken down into a number of subcategories. But for the purposes of this webinar, I'm going to click on the general diabetes hyperlink. And the reason I like to use diabetes is because not only is it so commonly diagnosed in our country, but because it's a great example of a diagnosis that requires a lot of expense in addition to medications. A lot of people living with diabetes are looking for help affording things like testing supplies, syringes, assistive technology. And as you can see, there are currently 63 diagnosis-based assistance programs for people living with diabetes. Like the other databases, there are a number of, all of the pertinent information is on your screen, including the program name in the left-hand column and a hyperlink to that program if one is available. The next column is a summary about that program. And the two most important bits of information are going to be the columns on the far right, the services this program provides, as well as the areas of service. And as you can see, the services provided can vary greatly. Oftentimes, you'll get help affording things such as medical supplies or assistive technology. But as you can see, they really do vary. This one offers help with respite care. There's a couple here that actually will help your patient or client get a service animal, which is super important. The right-hand column, the areas of service, you'll notice what you're looking at now is national. That's because all of the programs that are national, meaning you can live anywhere in our country to apply, are listed at the top. And then as you scroll down, the programs are listed alphabetically by state. Now, returning to that patient savings tab, at this point, I hope you're starting to see that all of our databases are set up really similarly, and we're hoping that that makes it easy for you to navigate. I'm not going to go through in detail tons of the other databases because, as I said, hopefully you're starting to get the hang of this. But you'll notice a couple of things I want to point out In the beginning of the year, we also added a whole section for medical transportation, which is really important, and you can search according to diagnosis in the state you live in. Maybe you need to refer a patient or a client to a specialist or a specialized facility, and it's not the easiest thing in the world for them to get there. Check out our medical transportation section. Also encourage you to check out our retreats, camps, recreational programs, and scholarships database. And that's exactly what they sound like. They're retreats and camps, as well as educational scholarships available for people living with a specific diagnosis. For those of you that work with the senior population, the government programs is a great section because it provides pretty exhaustive information on Medicare and Medicaid. And the government program section also lets you know what health savings programs are available in your state. And that's going to be pretty important. Now, before I switch out of our live website back to the PowerPoint presentation, so I can talk to you about another way to help your patients or clients save, which is with the NeedyMeds Drug Discount Card, I want to point out our Advocates tab. For a healthcare professional, this is a great way to not only stay up to date with what's going on with NeedyMeds, but also to stay up to date with other important healthcare topics. I encourage you to check out the webinars section of our website. I encourage you also to sign up for something called our Patient Assistance Resource Education course and exam. Normally, we charge people $15 to take the PAIR course and exam. And what this is it's a web-based self-paced tutorial designed to teach users how to find what they need on the NeedyMeds website. At the end of the exam, we will provide you or your team or your staff with a certificate of completion. As I said, we normally charge our students $15, but I would be more than happy to waive that fee if you and your team are interested in taking the NeedyMeds PAIR course and exam. If you are interested in doing that, just send me a message in the questions section of your GoToWebinar control panel, and we'll be happy to take care of that. Also, under the Advocates tab, I encourage you to sign up for our Patient Assistance newsletter. And on the left-hand side is where you can sign up to receive other email alerts and, very importantly, order NeedyMeds print materials and brochures. So with that, I'm going to go ahead and escape out of the escape out of the live website onto the PowerPoint presentation so I can talk to you about the NeedyMeds Drug Discount Card. For those of you that are not familiar with drug discount cards, they all work the same. But I'm going to talk to you a little bit about why the NeedyMeds Drug Discount Card is different. First of all, with the NeedyMeds Drug Discount Card, users can save up to 80% off the cash price of prescription medications, as well as over-the-counter medications and supplies as long as they're written as prescription. You can also use the NeedyMeds Drug Discount Card to save on pet prescriptions if you pick it up at the People Pharmacy. If you'd like to learn more about that, because I don't want to take up too much of your time today, but if you are interested in learning more about that, please shoot me a message again in that questions section of your GoToWebinar control panel, and I'd be happy to share with you a less than 10-minute video on how to use our drug discount card to save on your pet meds. And really importantly, you'll be able to see a picture of my puppy, Benjamin. So with the NeedyMeds Drug Discount Card, a big question is, who can use the card? And the answer is anyone. Here's the rules, though. The NeedyMeds Drug Discount Card cannot be combined with insurance. So if your patient does not have insurance, they can use the card anytime. If they do have insurance, they may choose to use the card instead. And they may choose to do that because maybe they find their medication isn't covered under insurance. Maybe they find themselves in a coverage gap, or maybe they have a high copay or a high deductible. Now, I said at the beginning that there are lots of drug discount cards out there, and I'm going to tell you why NeedyMeds Drug Discount Card is different. And I think the most important thing is not only is it free, because you and your patients and clients should not be being charged for a drug discount card, but it's also anonymous. What that means is we do not track who is using the card or any of their personal information. The only thing we track is the number of times the card is used and the dollar amount of savings. So that's really important for our users to remain anonymous, but because the card doesn't have any identifying information on it, it also means that the same drug discount card can be used with family, friends, loved one, neighbors. So let's go ahead and once again, bear with me while I transition out of the PowerPoint back to the live website so I can show you how you can request free drug discount cards and the tools to maximize savings. Now, really importantly, you can always refer somebody to our website, or they can call our counselors again at 1-800-503-6897, and they'd be happy to drop some drug discount cards in the mail. Or you can click on that green arrow on the red arrow on the left-hand side, and there's a couple of ways you can get the drug discount card here. First of all, you can print out the downloadable PDF and just make sure your patient and your client cuts out this top part. That's the information that's going to be important to the pharmacist, the bid number and the group number. Or your patient and client can fill out the form right here, being sure to choose a design, and we'd be happy to drop one in the mail. Of course, they can always mail us a self-addressed stamped envelope to our P.O. box. If you need to order a number of drug discount cards, check out the Advocates tab, and you can visit the Order Print Materials or NeedyMeds Brochures tab. Of course, at the end of the webinar, I will provide you with the contact information from my colleague Alana, who can send you drug discount cards in large quantities. So let's say you or your client have a drug discount card. The next step is finding out what pharmacies in the area accept the NeedyMeds drug discount card, and we make that really simple. First of all, the chances are very high that the pharmacy in your area will accept the NeedyMeds drug discount card because it is accepted at more than 65,000 pharmacies nationwide. And how you can find a pharmacy in the area, of course, you can give our counselors a call, or you can go to the bottom of this page on the pharmacy search. So we're just going to type in the zip code of where NeedyMeds is. And as you can see, all I did was type in the zip code. Actually, I was really specific and I put in an address there. And there are all the pharmacies that accept the NeedyMeds drug discount card within 5 miles of the 01930 zip code. And as you can see, it gives you the name of the participating pharmacy, the contact information, as well as map and directions. And you can, of course, choose the print all list, doing just that, printing a list for your clients so they know what pharmacies in the area accept the drug discount card. So now let's say you've provided your client with the drug discount card. You've told them what pharmacies accept it. The final step is finding out how much will the cash price of the drug cost using the NeedyMeds drug discount card. And you can find that out by clicking on the drug pricing calculator on the left-hand side. To find out how much the drug will cost you, you'll need 4 pieces of information: the name of the drug, the dosage, the quantity, for example, whether you're looking for a 30, 60, or 90-day supply, and finally the zip code where the pharmacy is or where the patient will plan on picking up the medication. Couple of disclaimers I want to mention about the NeedyMeds drug pricing tool. The first one is that drug prices change all the time. So don't check what the price is today and then go pick it up 2 weeks later, because chances are that price will have changed. Will it have changed dramatically? Probably not. But the point is it will have changed. So you're going to want to check out how much the drug costs today and pick it up pretty quickly. The other thing I want to point out is the drug pricing tool provides an estimate. Now, although it's a very close estimate, it is not accurate down to the penny. And I'm really careful to make sure I mention that because my mom used the drug pricing tool and the drug discount card. And although she saved a bunch of money, it was about 15 cents off. And I forgot to mention it wouldn't be accurate down to the penny. So I want to make sure that I mention that to all of our NeedyMeds users, that again, although it'll be accurate, it may be off by a few cents. Before I stop talking about the NeedyMeds drug discount card, there's one other thing I want to mention to our healthcare professionals. Under the Advocates tab on the right-hand side, you'll also see a link for drug discount card partnerships. What that means is, instead of distributing NeedyMeds drug discount cards with the NeedyMeds name and logo for free, we can create a drug discount card with your organization's name and logo. One thing I do want to mention, I say for free if you're comfortable having your logo printed in black and white. If you do need your logo printed in color, we will have to charge you for that. We're not making money off of it. It's just that as a nonprofit, we can't absorb the cost of printing color drug discount card. But if you aren't interested, we'll be happy to create a drug discount card with your organization's name and logo on it. What that will do is it will allow you to track the number of times your drug discount card is being used and the dollar amount of savings. And as I said, we don't track personal information, but those two statistics may be something you're interested in. And how you will keep you abreast of your drug discount card usage is we will send you complimentary monthly reports letting you know exactly that, the number of times your card has been used and the dollar amount of savings. So again, if that's something you're interested in, you can send me a message in the questions section of your GoToWebinar control panel. A couple of other things I want to point out while we're on the NeedyMeds live site. On the bottom right-hand side, because I'm going to point out some of our upcoming webinars, you'll see the calendar events. This is where we list our webinars. And I'll also encourage you guys to check out our social media platforms. In particular, the third icon from the left is the NeedyMeds YouTube channel. I would suggest visiting this because this has all of the videos of our special topic webinars. You may find something that's useful to you or your clients that you can watch at your own convenience. So again, I'll encourage you to submit any questions you may have into the questions section of your GoToWebinar control panel. And in the meantime, while I have you as a captive audience, I'm just going to review a few things. These are just some of the most important ways that you can help your patients or clients. First of all, simply being aware that NeedyMeds exists. If you don't have the resources to walk your patients through our website, simply refer them there or have them call our helpline. Again, that's 1-800-503-6897. If you've listened to this training and hopefully you were so excited that you want to scream about what a great presentation Carla gave and how fantastic NeedyMeds is, and you just want to share it with everyone, please know I would be more than happy to schedule a personalized training for your team or your staff. We'll set that up remotely via our GoToWebinar platform, and that can be, again, at a date and time and within a time frame that works for you. Again, under the Advocate section of that NeedyMeds, on our NeedyMeds website, please do sign up for some of our mailings, order some of our brochures and drug discount cards, and sign up for a monthly patient assistance newsletter. One thing I didn't mention is something called PAP Tracker. For those of you that may be helping people apply to prescription assistance programs, NeedyMeds has a software called PAP Tracker. And what that does is PAP Tracker eliminates the administrative burden of having to manually apply for and track prescription assistance program applications. So again, if you're interested in that, send me a message in the questions section of our GoToWebinar control panel, and I'll have my colleague Sal reach out to you to give you some more information about that. And of course, a couple of other ways is simply to distribute educational materials and provide your patients or clients with your own drug discount card. There's a snapshot of some of our upcoming webinars through the end of the summer. We do hope you register for them. They're always free. And if you miss it, check out our YouTube channel because we do our best to convert our webinars into videos as quickly as we can and post them to our YouTube channel. So with that, I'm going to open up the floor for questions. And for those of you that have to log out, I want to make sure you have our contact information as well. We do encourage you to please offer feedback you may have about NeedyMeds on the Great Nonprofits website. You can email me directly if you have questions about this webinar, about the Patient Assistance Resource course and exam, about PAP Tracker, or anything that I've covered. I also put my colleague Alana's contact information if you're interested in receiving informational materials, educational brochures, or a drug discount card. And don't forget, because I don't think I've said it enough, our NeedyMeds toll-free helpline is 1-800-503-6897, and we do have Spanish-speaking counselors. So let's see some of the questions coming in. This is a great question that people in general are seeing prescription assistance program becoming more restrictive and require more hoops in general. I would not say that it's necessarily an overt trend, but I can attest that sometimes we are seeing some of these supporting organizations getting a bit more restrictive and the eligibility requirements being a little bit more strict. That's why I think it's really important to reach out to a call center counselor. And what I mean by that is they may have a creative way to go about getting help for a specific diagnosis or a medication that maybe a newcomer to our website wouldn't be aware of. So I encourage all of our users to reach out to our expert counselors on at our call center. Another great question about a prescription assistance program. Let's say somebody submits an application for a prescription assistance program, but then they're denied. The question is, would we recommend a patient call back if that request was denied? And the answer is an enthusiastic yes. A lot of times, the prescription assistance program is willing to make what is called an economic hardship exception. So I would absolutely say to reach out to them and ask if they will reconsider. Many of them also have an official appeals process. And in the event you're looking for assistance for a medication that does not offer a prescription assistance program, you can call the company directly and ask them to make what's called an economic hardship exception. They do that all the time. So the answer is absolutely it's worth a phone call. Let's see some other questions coming in. Oh, I see a lot of people interested in taking the PAIR course and exam. And again, I'm going to waive that fee for only people that participated in today's live webinar. And certainly, if you have a team member or manager that is interested in taking the PAIR course and exam, but they weren't able to join us today, of course, I'd extend that offer to your team members. It would be my pleasure. For those of you writing in because you're interested in learning about how to use the NeedyMeds drug discount card to save on your pet meds, thank you. I will shoot you an email with the hyperlink for that video tomorrow morning. So here's a great question. If somebody has a prescription for an over-the-counter medication, for example, maybe Tylenol, can they use the NeedyMeds drug discount card at their local pharmacy? And the answer is yes, they can try. The answer with the drug discount card is always going to be you should try, because we don't know from day to day what drugs are going to be discounted. With that being said, I think this is a really important opportunity for let me back up. This is a really great opportunity for me to stress something that's really important. To use the NeedyMeds drug discount card, as I mentioned, you do need a prescription. Oftentimes, for example, when you go to the doctor and they will tell you, for example, I went to the doctor recently and they said, Carla, I know your foot is hurting you, so just go ahead and pick up a foot brace. And I know your allergies are going crazy, so just go ahead and get Claritin D. And I know you have a little swelling also in that foot, so just go ahead and pick up some ibuprofen. Well, all that the doctor just basically told me to spend $50, $60 out of pocket, which I don't have. A great thing is, if somebody is fortunate enough to have drug coverage, sometimes if the doctor calls in an over-the-counter medication as a prescription, you may find out that drug is covered. For example, I've been spending tons of money on something like Claritin D for my medication. Finally asked my doctor for a prescription, and it turns out my insurance company will cover an allergy medication. But if they didn't, as long as I have a prescription from the doctor, you can match the prescription with the drug discount card and see if a discount is available. Let's see what else. Okay, we have a question about what kind of training and testing does NeedyMeds provide. So two different things. One, I was saying, if you work with a team or a staff of people that you think would benefit from learning more about NeedyMeds, contact me or shoot me a message in this question section, and I would be happy to schedule a personalized webinar at a date and time of your convenience to talk more about NeedyMeds. That was the training I was referring to. The testing is something called the PAIR course and exam, and that's the Patient Assistance Resource Education course and exam. And that is basically a web-based, self-paced tutorial that will teach users about NeedyMeds and how to navigate our website. That PAIR course and exam, we usually charge people $15 to take it. I am happy to waive that fee for people that attended today's live presentation or for their team members if they think they'd be interested. You can send me a message in that question section of the GoToWebinar control panel, or you can shoot me an email at carla@needymeds.org. A lot of people often ask whether we provide continuing education units. We do not, but we do provide a certificate of completion. We have a question coming in about the NeedyMeds drug discount card, and the two types of information or statistics that we track the number of times the drug discount card is used and the dollar amount of savings. Bear with me while I scroll through some of these questions. So this is a great question, and it's not silly at all. Thank you for this question. Whether or not for discount on pet medication, should the patient fill out the form in their name or the pet's name? That's a great question. So what would normally happen, and you'll see this in the video, and I'll shoot it to you again by tomorrow morning, is if your pet is being prescribed a medication, you'd get it from the vet. What you're going to do is, instead of getting the actual medication from the vet, you will get the written prescription, and it'll have your name as the owner, and it'll also have your pet's name on it as well. Let's see what else. So here's a great question. How do drug discount cards work with other community health centers that may have different programs? And the answer is yes, the drug discount card cannot be combined with any other program. So if you are using the NeedyMeds drug discount card, that's all you can use. It can't be combined with another program. It can't be combined with a coupon, and it can't be combined with insurance. NeedyMeds, although we were founded just over 2 decades ago, we only created the drug discount card in 2009. And the reason we did that is because if somebody turned to NeedyMeds and needed help affording their medication and we couldn't connect them to a program, we wanted to make sure we had a safety net, a last resort for them to be able to try and get some savings. So that's the purpose of our drug discount card. We're probably the only drug discount card we're probably the only organization that has a drug discount card that hopes you never have to use it. Our first goal is to make sure that we connect you with a program that will work specifically for your client or patient's need. So do keep that in mind. So I'm seeing a bunch of people writing in, asking about whether or not the slides are available for today's presentation. And you should be able to access a PDF of my PowerPoint presentation in the handout section of your GoToWebinar control panel. If you're having difficulty, shoot me your email and I'll be happy to send it to you via email. Again, I'll take care of that tomorrow morning. So if you're looking for specific assistance, I've had a few audience members write in asking whether or not we have programs for specific generic or name brand medications. We have a number of people looking for assistance for specific durable medical equipment, maybe CPAP machines or oxygen machines. I don't know off the top of my head, and what I'm going to do is refer you to our 800 number. Again, we're on the East Coast, so we're open 9 to 5 Eastern Time, Monday through Friday at 800-503-6897. So specifically, we have somebody asking about whether or not we have resources to assist with lapsed Medicaid coverage. What I would suggest, again, is calling our counselors, because we do have videos on handling certain insurance questions, so you can check that out and see if they can refer you there. But I would also suggest reaching out to a SHIP or SHINE counselor in your area. And I'm going to escape out of the PowerPoint presentation and go, bear with me just a moment, and go to our live website. Under the Patient Savings tab, just bear with me. There we go. Let's make the screen a bit bigger. Under the Patient Savings tab, on the right-hand side, you'll find the Government Program section. As I had mentioned under here, there's tons of information about Medicare and Medicaid. But we also have all of the 50 federally funded, 50 states, there's usually more than one in a state, federally funded health advisory programs called SHIP or SHINE. They're a great resource if you're looking for assistance with your Medicare inquiries. Let's see, what are the other questions coming in? So again, we're getting a lot of questions for Medicare and Medicaid, and I'll refer you to that government program section on our website. Check out that hyperlink for SHIP or SHINE, or call our call center counselors at 800-503-6897. So with that, I think we're going to go ahead and wrap up today's presentation. I know you are all very busy, and it is a Monday, so I appreciate you taking time out of probably your overwhelmed schedule to learn a little bit more about NeedyMeds and the resources we offer. Hopefully you did find some ways that your patients and clients can save on their healthcare needs. For those of you that I didn't get the chance to answer your specific question, you'll hear from me tomorrow via email. Of course, in the meantime, you can reach out to NeedyMeds or check out our website. Thanks so much, and have a happy and healthy rest of the week. Take care.